basically my qualification, my career. So happy to start a discussion on what kind of opportunities are there in the digital health sector and what all the students that are and professionals as well who are interested in becoming entrepreneurs or working with startups or working with in digital health sector can learn about this field and how to enter this field. So briefly, I'll start with the what digital health is. Basically, it's an intersection between ICT and health. So the healthcare sector and the ICT sector, which is information and communication technology sector, join together to bring to bridge the divide between the two sectors. So ICT is used to basically manage illnesses, health risks, and the promotion of wellness. Secondly, there are huge advances currently being made under the umbrella of digital health when it comes to artificial intelligence, big data, robotics, machine learning, and these changes help and support in enabling digital healthcare services to be accessible to most of the people. Currently, there is a huge disparity between people who can access healthcare and who can't. So it helps in making it cheaper, making it more accessible. When we look at the market, the expected growth, the compound annual growth rate of the digital health market is really strong, with an expectation of 28% of growth in the next 6 years. So when countries like Pakistan, which are considered as low and middle income countries, when we look at this, it's really beneficial for us because firstly, countries like ours, the smartphone utility, the usage is increasing in the country. So if we do have digital health services introduced to us, we would be able to adopt them immediately. It would facilitate our people to easily access healthcare at very low cost. So this is a phenomenal move for countries, not just developed countries, but also developing countries to invest in this sector and encourage students, encourage individuals to invest in, to promote this sector and contribute towards it. Moving on, yeah. So when we look at the global impact of the digital health sector, so more than 8,000 companies are currently working around the world in this sector. But when you look at the figures, there is a lot of investments currently taking place in clinical intelligence and enablement. So what we mean by that is patient development, management platforms, and care coordination tools. So this is where most of the companies, the top companies, are currently working in. This is strongly followed by screening and diagnostics. So the 16% of the companies, the 150 companies that were studied in this report, they say that screening and diagnostics is a close follower. Personally, I mean, even research says that when the COVID pandemic started, well, people couldn't access healthcare services the way they normally did because of social distancing rules and lockdowns, etc. So the easier way was to sort of develop these quick solutions. So innovations were made in ensuring that artificial intelligence and machine learning is used to develop tools that could, for example, most popular were the tools of X-ray diagnostics. So if you took an X-ray, an app, a machine, whether you can diagnose COVID, you can diagnose COVID with those apps easily. There was another innovation where a group of MIT students developed an app where you could cough into the app, and based on the sound of the cough, you could diagnose your own self whether you have the COVID symptoms or not. So these come under screening and diagnostics, and these were really strong advances made towards making it cheaper and accessible for individuals to have their tests done from the convenience of their homes. When it comes to clinical intelligence and enablement, platforms were developed. Some were already there, but others were developed where you could access doctors online, where you could book appointments and have online consultations as well. So there are around 300 digital health startups currently operating in Pakistan. And the focus is basically, majority of these companies are focused on telemedicine and digital pharmacies. So these are the strong, and telemedicine companies, there were almost more than 20 companies when COVID was at peak. where doctors could update their profiles over there, and patients could look for them, compare the services, compare the charges, and move on and book appointments. So when it comes to artificial intelligence and healthcare, so the doctor to patient ratio is in Pakistan, and this is the case for most of the developing countries. So for every 1,000 individuals in the country, we have less than one doctor available available to the population. And because of COVID-19, and even before that, there was a very high demand for doctors in the country. But another factor that affects this is that there is the availability of doctors around the country is concentrated in areas where in major cities. So the countryside, the outskirts, the least developed areas of the country, the accessibility of doctors is even lower as compared to the major cities and the city centers. So that causes a problem of cost and accessibility. People have to travel long distances to access a doctor. So it is this problem, the cost and access, that can be resolved by digital healthcare, and specifically AI, the use of artificial intelligence technologies. So currently, the IT sector is considerably strong in Pakistan. So I was talking about how there are very few doctors in the country, and the accessibility is a huge problem. How IT companies in Pakistan can contribute towards development of this sector, which is digital health sector. So when it comes to AI, there are many tools that can be used under digital health sector, but AI is considered to be a dire need for countries like Pakistan, because it allows the very few doctors to sort of delegate tasks to the machines so that they can support them in delivering quality healthcare. Moving on to the AI market, and after this, we'll discuss how careers can be made. So when you look at the opportunities, currently, when it comes to digital health services, there are a lot of opportunities that the students, that the other professionals can take advantage of, especially the startup companies or IT companies that are currently operating in the country. So the opportunities mostly effective would be developing portable, cost-effective telemedicine tools and systems. So in countries like ours, you have the main hospitals in the city centers, but you have basic health units. But those basic health units, they don't have those high-tech solutions or machinery that is, or even specialists that are available in major hospitals. So if you have cost-effective, portable telemedicine tools, equipping the basic health units through ICT, connected through ICT to the major hospitals, that gives you a good opportunity to develop systems, to develop tools, so that patients who are in far-flung areas won't have to spend money or resources traveling to major hospitals, and get treated, get prescriptions, get solutions right where they live. This will also reduce the load on the existing hospitals, major hospitals in the country. Secondly, there is a dire need of innovation in telehealth. As we witnessed during COVID, that telehealth was something that was really booming and was really required by all the hospitals and practitioners. Second is AI diagnostics, using artificial intelligence to support doctors in diagnosing diseases, problems, issues quickly and efficiently and at low cost. The one important category is digitization of patient records. So currently, most of the hospitals have records that are in physical form. And this, bringing them to digital format, would support in developing artificial intelligence or machine learning-based solutions because of the availability of big data of hospital records. So the barriers that are there, where we need support in digital health sector is, first of all, as I said, there is lack of digitized data. So AI machine learning feeds on data being digital. So the first barrier is that there is a lack of that service, that facility, because most of the public health centers, public hospitals have data in paper format. So that going digital, if hospitals, public sector hospitals go digital, that would benefit the AI community immensely. Secondly, the utility of AI, no doubt, is beneficial for the whole country, for the whole world, but its utility is really high for far-flung areas, for least developed areas. But the problem is there is limited internet accessibility in those areas. Secondly, there is limited power supply, there is limited electricity as well in those areas. Third issue is that the literacy is low. So there is a lot of need to sensitize the population and to sort of make them comfortable with using smart technologies. Another issue is the low penetration of smartphones in these areas. So while AI can benefit least developed areas in any country, the issue is that the tools to help them benefit from it are really limited or unavailable. Another issue is the ethics of using artificial intelligence. Currently, there is work internationally going on developing rules and regulations and policy, but of course, in developing countries like Pakistan, this is very much in need. So the government and the policymakers need to focus on making sure that the tools that are being developed when it comes to not just digital health, but any health sector are following the ethics that are currently, the standards in the international market. So while AI and digital health is relatively new, there are opportunities for both local and international players to capture the market as it's ready, it's ripe. But also there are barriers that the government and the public sector or private sector can support in, overcoming those barriers. And there is a dire need from the policymakers to ensure that there's a strong legal and regulatory system that is also implementable. Final words that I have as we round off this conversation. I understand there has a lot has been spoken about entrepreneurship, about innovation, about the skills, the talents. I understand I have a diverse set of audience who are students, who are professionals, individuals who are interested in this domain. So if you are a student, previously in the previous panel, the engineer Saab mentioned about how Google was a thesis, was a project that then became a company. So following on that, so if you are a student and you, as your final year project or as your thesis, your dissertation, you can choose to study or focus on digital healthcare or AI systems in digital health, or any of the terms that come under the umbrella. No matter your background, you could belong to a technical or non-technical background and still work in these fields. So you could use that time that you have, that 1 year, that 3 years if you're a PhD student, to study the sector, to study what's going on, to pick on the trends and understand the whole market, the whole sector, the industry, and use that knowledge to develop, to come up with a strong research, to come up with facts and figures, which you can then use to enter the market. You can either build your own company, you can either join a startup, or you can either join a company that is already working in there, and you would be a very good candidate for them because you would be equipped with the knowledge, the background, the industry tools to support you in working for that in organization. And if you're already a working professional, you want to switch towards digital health, there are many means that you could use. First of all, build your LinkedIn profile and start reaching out, connecting with people who already work in the sector. Take advice from them, learn from them, and grow from them. You can also curate your job applications and show your passion, show your interest that you really want to sort of enter this field, work for this field, support the country, support the company in developing these literally life-saving digital tools and technologies. And when it comes to the digital health sector, there are many ways you can sort of avenues for you to enter these companies. You can start working with startups. If you have a technical background, that's perfect. You could work on the technical side of the things, but not having a technical background shouldn't prevent you from entering the field or working in the digital health sector, because your skills and talents could be used for funding, for marketing, for business development, for design, user experience, all non-tech sort of business and marketing related fields. So not having a non-technical degree should not be a barrier for you. You could use that to support the startup, to support the company, or even a lab, because even currently most universities where they're looking to recruit people because they're doing research, really basic, really strong research in digital health. So you could support them in fundraising, in management. I would close this presentation, discussion with these final words.